all, this is my first time speaking in front of more than like 5 people at a time. So please bear with me if I quiver and shake. And I wrote every single thing down. I'm sure it was silly. My name is Rachel Quinn. I am the mother, a single mom to 2 former preemies. I'm also a registered nurse with my last 4 years being in the NICU. By a show of hands, I would like to see how many of you actually work in the NICU. Wow. And keep your hands up for me. I want to know if any of you have had babies in the NICU. Gosh, do you see the difference? Did anybody look around? Probably 95% of the hands went down. First, let me say that anytime you have to leave your child in the hospital is difficult, no matter the length. I have always had a passion for helping sick children, and little did I know that my own children would drive that passion further. My story begins with my daughter, Jalen. My pregnancy with her was uncomplicated up until about 29 weeks. I took my vitamins, regularly attended prenatal classes, and ate healthy. I was working as a nurse, 3 12-hour shifts per week, when at 29 weeks my water broke at work. I got admitted to labor and delivery, was given antibiotics, IV fluids, and steroids. For 1 week I was on bed rest, and at 30 weeks I gave birth to a 3-pound, 6-ounce baby girl. Jalen did remarkably well for her gestation. She was on oxygen for 3 days, antibiotics for a week, and came home after 5 weeks. Of course, we had the expected preemie naughties, the apnea, the bradycardia, caffeine, and vitamins. I was not working in the NICU during this time and was clueless what the plan of care was, what hurdles we would have to overcome, and what potential disabilities that she may end up with. I remember walking into the NICU one day as they were doing a head ultrasound, and I freaked out because I thought something was wrong. I wasn't told that this was the standard of care and didn't know at that time what they were looking for or why. I was not well educated and definitely not included in her cares. I was welcome to visit only for feedings, 30 minutes every 3 hours, and not during 6 to 8, which was report time. Even when I came every day on a schedule, some nurses would do her cares before I got there. That hurt because changing a diaper and taking a temperature was the most motherly I could be at that point. Once we got home, things went well. Jalen met all of her developmental milestones for her actual age, not her adjusted age, except when it came to walking. After multiple visits to a pediatrician who wouldn't listen, I took Jalen to Shriners Children's Hospital in Tampa at 18 months old. Jalen was a tippy-toe walker, as Kathy had mentioned earlier. I never knew what her head ultrasound showed. No one ever told me. But when she tried to walk, it was straight up and down. She couldn't physically flatten her feet at all. She had tight heel cords and probably cerebral palsy. I opted not to get the head MRI to diagnose it. We ended up with serial casts from the knees to the toes. The casts were changed weekly for 6 weeks to gradually stretch her heel cords. We were told she would then need braces until the age of 16 and possibly Botox injections. It took Jalen 1 month to get her strength back, and as soon as she figured out that she could walk without those braces, she refused them ever since. Jalen was 22 months old before she would walk unassisted. I do feel somewhat responsible for her tight muscle tone and feel that if I had participated with the early developmental therapies, things may have been different. The reason I didn't was because upon discharge from the hospital, I was given a handout that said, call if you have any concerns. I'll go back to that picture later. I thought since she was meeting all of her milestones that there was nothing wrong. I have learned that those therapists see things in a different light that parents don't see. If Jalen had been seen from the beginning, it may have prevented her tight heel cords to begin with. Jalen is now almost 7 and is doing well in school. She loves dancing, basketball, acting, and swimming. My experience with my son has been a complete opposite. His name is Landon. He was the one screaming as everyone was sitting down. He was born at the University of Iowa at 25 weeks gestation. During my pregnancy with Landon, I had many challenges. A move from Florida, a divorce, a new job, and I couldn't eat. Anything greasy or fried, pasta, marinara sauce, and even chocolate would feel like a brick in my stomach. I was bound to salads, broth-based soups, crackers, and baked chicken. Not on purpose, I weighed 10 pounds less when I had him than when I got pregnant. I was on progesterone injections beginning at 16 weeks in hopes that this would prevent another early delivery. My 19-week ultrasound proved everything to be okay. Then 5 days later, at 20 weeks, my water broke. I knew instantly what happened, but the reality did not hit me until I had to say it out loud to first my parents and then my doctor. Once my doctor confirmed my fears, the panic of what now set in. I knew viability was far from where I was. My mom looked at me for a plan. After all, I had worked in the OB world for 2.5 years. Shouldn't I know what to do? But I didn't, and neither did my doctor. He called the University of Iowa and reported to me that I couldn't be admitted until I was 23 weeks and 5 days. Apparently, this was the earliest I could receive the steroids for the baby's lungs. How was I going to reach that 4 weeks away? My doctor and I discussed my options, both of us knowing there was a slim chance that this baby would make it alive. I was admitted to the hospital, got 48 hours of IV antibiotics and fluids, and I went home from there. Oh, I'm sorry, I totally skipped the whole page. Okay, she admitted me to the hospital for 48 hours of IV antibiotics and go from there. As my mom and I left the office, we held on to each other crying. Underneath the tremendous pain and helplessness, we looked at each other and we knew we'd fight till my body or my baby said stop. I spent 2 days as an inpatient getting the IV fluids and IV antibiotics. My admitting nurse was the only one who hugged me and said, "You might have a chance." Others made comments like, "You're selfish, you don't know how you're making that baby suffer. He will be born without arms, legs, hands, or feet from urine compression. And even if you make it to viability, the baby's lungs will not be mature enough to sustain his body. Plus, he will be deaf, blind, mentally damaged, and need lifelong care." Of course, I realized there were risks. I also knew I wasn't going to induce unless my body began contractions on its own. I made up my mind that I would accept whatever was to be my outcome, but I wasn't going to give up. I went home with my water broken and prayed. I searched the internet for statistics or someone's story and found nothing. I called a perinatologist here in Iowa City and explained my situation. Shocked, I heard from her, "Looks like we'll see in a few weeks." Finally, I had a glimmer of hope. So 3.5 weeks went by. I stayed on complete bed rest, checked my temperature every 4 hours, drank at least a gallon of water per day, and increased my sodium intake to help my body retain fluid. Baby's lungs develop from the amniotic fluid, and the amniotic fluid is made from the baby's urine. So I figured if I drank, he would stay hydrated, he would urinate, continue making amniotic fluid, and develop his lungs. I got 2 ultrasounds a week to measure my amniotic fluid and to check for a heartbeat. My fluid level was always 1 to 3 centimeters. Typically, women have 15 centimeters or more. Every hour, I prayed for him to move, so I knew that he was alive. I continued the progesterone and prenatal vitamins, ate well, rested, counting the days until I could go to Iowa City. 23 weeks and 5 days arrived, and off we went to the ULI. I checked in, got settled in my room, and got my first dose of steroids. For the first time in a month, I felt safe. At least I was giving my son the best chance at life that I could. 2 weeks would go by, non-stress tests, contraction scares, visits from family, Thanksgiving, more sterile spec exams than I ever could think about. And then I got sick. Severe abdominal pain, 103-degree fever, vomiting, and delirium. Everyone thought, choreo. I had severe kidney stones. I basically had sand coming from my kidney all the way down to my bladder. It was blocking the passage of urine. My kidney was swelling with urine infection. I had to get a perk tube placed directly into my kidney in order to drain the urine into a Foley bag. 2 days later, my son was born at 25 weeks and 5 days. He weighed 2 pounds 1 ounce, which is 952 grams, and was 13 inches long. He was the size of a Barbie. I was thrilled he was over 2 pounds, and he screamed after delivery. Now it was up to him to fight. I had done all I could do. With Landon's first chest x-ray, it was confirmed that his lungs were proportionate to his body size and fully inflated. He even breathed on his own with no ventilatory support for about 12 hours. This was the first miracle in my eyes. Next was his head ultrasound. I held my breath as I expected to hear the worst. When I was told no brain bleed detected, bursting into tears is my way of exhaling. The first time I got to hold him was to simply lift him up as the nurse changed his bed. This is something I now pass on to my patients' parents. Every day I walked into the NICU, I couldn't scrub my hands fast enough. My stomach would knot in preparation for what I might walk into that day. Once, I happened to walk into a near code situation. The nurse that day was resuscitating Landon, still in the vent at 34 days old. Instinctively, I asked her, how many times has this happened today? She told me 4 times in a 4-hour period. Being a nurse, I was like, oh no. With my coat still on, I went seeking a doctor. That day, Dr. Bell would meet us for the first time. I fought with myself, be a mother or a nurse. Dr. Bell looked at me with shock in his eyes as I ran down Landon's history, labs, x-rays, and vent settings. I was amazed when he turned to me and included me as to what steps we should take next. As the code cart got brought in and my son almost died, I was included as a part of the team that helped save him. That day, my respect for the staff of the NICU overwhelmed me. Landon was a patient for 4 months and 1 week. After many ups and downs, 4 blood transfusions, on and off the vent, workups for infections, difficulties feeding, and not enough holding, I was finally able to take Landon home at 41 weeks gestation. We had an apnea-braided cardio monitor, numerous tanks of oxygen, an NG tube, as I refused to peg tube, and 17 doses of medications per day, mostly all for breathing. When Landon was discharged, he was unable to eat his feedings by mouth, so I had to infuse breast milk overnight in order for him to meet his caloric needs. I had a feeding pump, a scale, a suction machine, and eventually pulse ox. I begged. I need it! That was all set up in my bedroom, and we had our own little NICU. By the time he turned 1, we had weaned off of everything, with the oxygen being the last to go. We've been readmitted twice for breathing issues, but Landon has never had any heart problems, no brain bleeds, no intestinal infections, no hernias, and no retinopathy of prematurity. Bracing myself for these possibilities began at 20 weeks of pregnancy for me. I pumped breast milk for 5 months, made time for my then 4-year-old daughter, lived between the hospital, the Ronald McDonald House, and home 50 minutes away. And I went back to work. The juggle was exhausting. To all of you who not only took care of Landon, but me, along with all the other preemie moms in the world, we thank you for your patience and understanding. Usually, I'm not a crazed, sleep-deprived, anxious hormonal mess. But these traits are uncontrolled when you watch helplessly as your child fights for their life. Landon will be 3 next month, and he couldn't be more happy or more stubborn. We got discharged from the high-risk follow-up clinic in April. Speech, occupational, and physical therapies discharged us in July, and we got confirmed with no retinopathy 2 weeks ago. Landon was actually the first baby that you tried the video eye exam on. I don't know if any of you guys have seen that. Have you seen it? They, instead of using the clamps to open, well, they still open, but instead of just peeking, they actually videotape it with a camera. And he was the first baby who got that done. Although he's still small for his age, developmentally, Landon tests above a 3-year-old level. Medically, he's on Prevacid for reflux, inhalers for periodic breathing difficulties, and he has scar tissue in his nose from the nasopharyngeal tubes. Overall, he is a happy, healthy toddler who bears all the scars from each IV and heel stick as a reminder of his fight. Having a preemie can be a very traumatic ordeal for families. Please try to understand our worry and helplessness. Post-traumatic stress disorder is still and will continue to be a problem in my family. This experience has made me a better NICU nurse to the babies and parents I help. I wouldn't have my son if it wasn't for the outstanding support I received from complete strangers willing to give life a chance. Thank you.